Hello, everyone. Welcome. My name is Julianne Solorio, and I'm going to be presenting on the nurse burnout. So, my purpose statement is to inform the audience about nurse burnout, its causes, consequences, and evidence based strategies for prevention and recovery in healthcare settings. Imagine having a loved one in the hands of a nurse whose ratio is unmanageable while working 12-hour shifts, short staffed, and emotionally drained. Nearly 1 in 3 nurses report high burnout levels. Burnout is not just exhaustion, it's a systemic issue that affects nurses and patients alike. So the cause of nurse burnout can be due to the workload and staffing shortages, which can result in chronic understaffing, increasing emotional exhaustion, moral injury, and emotional fatigue. Ethical conflicts and patient suffering can cause deep distress. And then poor work balance, work-life balance. Long shifts and mandatory overtime limit recovery time. So the more you work, the less time you have to rest and recover before you have to attend your next shift. Prevention and recovery strategies. So organizational interventions are like supportive leadership, wellness programs, and better nurse to patient ratios. Being mindful and resilience training helps manage stress and emotional fatigue. And then policy reform. So the National Academy of Medicine advocates for systemic in healthcare environments. Causes of burnout. So for nurses, increased anxiety, depression, and turnover. For patients, more errors and reduced satisfaction. And then for healthcare systems, staff shortages and rising recruitment costs. So this one is I feel like I've definitely experienced it on the floor that I work on. And so when you are exhausted, you're just not in the right mental state. And you're just not happy to be back there for another shift. So I feel like definitely like the shortage in staffing does take a huge toll on your body, your mental state. You wake up and you're just either emotional because you're exhausted and your body hasn't recovered, or it's just not enough rest. We have lives, we have other responsibilities outside of work, and there's times where you're not always able to get the full amount of rest that your body requires, because one, you've had to cut into that time due to overtime, or you just have other responsibilities and you can only afford to get 3 to 5 hours, and then you have to get up and do what you have to do. So it's having to stay overtime definitely can cause these emotions, like anxiety and depression. And then for patients, it's also frustrating on the patient's side, because we're not able to fully give them or attend to them the way we should be, because we have our workload is unmanageable due to being understaffed. So finding better patient ratios. Sorry. Speaking of, finding better patient ratios will definitely help with the feeling of being burnout. And then the expected results are to raise awareness, leading to improved well-being and retention. Hospitals that support nurses see better patient outcomes and fewer errors. And then burnout reduction benefits nurses, patients, and in the entire healthcare system. So yes, in return, it's kind of, in a sense, like the happy wife, happy life. happy nurse, happy life, happy healthcare system. So when it's like a full circle, we have uh, a team of nurses that are being well taken care of. Their mental health is taken into consideration, their lives outside of the workplace. So all of that can in return create a better environment for the healthcare system. Less complaints from patients, maybe less lawsuits. Who knows? There's a possibility of that. And then nurses are the backbone of healthcare. Um, I highly agree with this. I feel like I have witnessed nurses do the job of a doctor and then get talked down as if they were less. But I think that if maybe nurses were allowed to just do only their duty, and the job and the doctor came in and did their response or their part of um, their part of caring for the patient, perhaps that might alleviate some of that burnout feeling. Um, Addressing burnout is essential for quality care and the survival of the profession. And then supporting nurses means supporting patients. So, once again, if the nurses are being well taken care of, and they're not overloaded with patients, or having to do overtime because they don't have any staff members to come in for the following shift, or whatever the situation may be, um, we're able to better support our patients and be better equipped to show up for our patients. And this is the references where I pulled my information. And yeah, I think that nursing, um, we need to do a better job at patient ratios and the staff shortages. It's been decades and decades of this issue, and I think that although I feel like we're moving the needle, but definitely need to continue to do better at making sure that our nurses are well taken care of. And they're saying that we have a shortage in nurses, and it's because a lot of people are realizing how the nursing field and healthcare field is just, it's a little messed up, and no one wants to jump into that and feel like they're undervalued and overworked. So yeah, thank you for watching, and I hope you were informed on nurse burnout.